Today we will be demonstrating TR band removal. Begin by explaining the procedure to our patient. Perform hand hygiene and apply clean gloves. An inflatable radial compression device is used to assist with hemostasis of the radial artery after a transradial procedure. The compression device will remain fully inflated 30 to 90 minutes depending on the procedure performed or according to the physician's orders. Please refer to the radial percutaneous access post-procedure care protocol for details. Assess the limb and TR band every 15 minutes times 4, then every 30 minutes or as needed until the compression device is removed. The assessment will include vital signs, neurovascular checks, assess radial pulse distal to the puncture site, assess the insertion site for presence of bleeding, hematoma, pain, or signs of infection. Monitor continuous pulse oximetry of the finger distal to the compression device. At the recommended device removal time, attach the compression device syringe to the inflation-deflation valve of the compression device. Withdraw 2 mL of air and observe the site for bleeding. Use caution when removing air from the device, as the syringe being under pressure will passively deflate. Hold your finger on the syringe plunger to prevent air from escaping too fast. If no bleeding is present, continue to remove 3 to 5 mL of air every 10 to 15 minutes until all air is removed. If bleeding occurs, re-inject the 2 mL of air or enough air to stop the bleeding. Note the total amount of air in the compression device is not to exceed 18 mL of air. Wait 15 to 30 minutes and attempt to remove air again if bleeding had occurred. If bleeding does not stop with full inflation of the device, notify the appropriate provider per policy. The RN may be instructed to remove the compression device entirely, apply manual pressure using 3 fingers, and elevate the limb. Once all the air is removed and no bleeding occurs, remove the compression device, taking care not to disturb the clot. Place sterile gauze and cover with a Tegaderm. Make sure to monitor closely for any signs of bleeding. Do not discard the TR band in case bleeding occurs and requires the device to be reapplied. After removal of the compression device, perform pulse oximetry to the affected limb, obtain vital signs, neurovascular checks, and insertion site monitoring per policy. Document time of compression device was placed, total volume of air in the compression device upon admission, condition of the insertion site, vital signs and neurovascular checks, time of deflation, time hemostasis was achieved, any change in the patient status, and patient education. Report to the physician uncontrolled bleeding, bleeding after the radial compression device was removed, loss of pulse oximetry waveform, new onset of pain to the affected hand or fingers, cold hand or fingers of affected extremity, numbness, tingling, and loss of sensation.